Ignaz Semmelweis. For decades, thousands of people died all over the world by sepsis or an infectious disease. By the beginning at 1800s, this caused 1,400 deaths per day. Many people got infections while admitted in the hospital. These kind of infections are called nosocomial infections, like the West Nile virus or hepatitis A, to mention some. On July 1st, 1818, in Budapest, Hungary, born Ignaz Semmelweis. He was known as the father of the infection control. He got his MD in Vienna in 1844. By 1847, he was responsible as an assistant at the division of the maternity service in Vienna. He observed that the women who delivered their babies at the hospital had a higher chance to develop an infection and die from it in comparison to the women who delivered their babies by midwives, trainees, and midwives. He associated that the medical students were doing autopsies to corpses before they delivered the babies. This problem was not seen by midwives, and this is why he came to the conclusion that the exposure and manipulation of corpses lead to the infection's transmission. Dr. Semmelweis initiated a trial where physicians and medical students should wash their hands, and mortality dropped to 2%, almost the same as the midwives. This trial was conducted by him, and he ordered you to use chloride of lime solution, and then he used the same solution to clean all medical instruments. Mortality dropped another 1%. However, his superior, Professor Klein, did not accept his theory and give the credit to the new ventilation system created in the hospital. He convinced some young supporters, but the senior staff didn't agree with him, and he didn't get his contract renewed for the following year. Feeling disappointed, he left Vienna and his supporters, and he came back to Budapest. In 1851, he was appointed head of the obstetrics department, but in public speech, he angrily talked to doctors and nurses. Later on, he wrote a book, The Theology, Concept, and Prophylaxis of Childbed Fever, but it was poorly written and it was not well received by the medical body. About 5 years later, he died in an insane asylum at 47 years old. About 2 decades later, his work was again revised, and he received credit for it. Nonetheless, his work was valid after Louis Pasteur, Robert Koch, and Joseph Lister proved the veracity of sterilization and produced more evidence about germ theory. Many physicians denied and avoided this method of washing hands because it was too much work, and following the protocols could mean change the entire hospital water pipelines. Physicians couldn't believe that they were the cause of the infection propagation. Nonetheless, for his 100-year anniversary of his death, Austria printed a postage stamp of his face in his memory, and the university where he was a professor is now called Semmelweis University of Medicine. This concludes my presentation. Thank you very much for watching.